Good evening, and thank you for attending tonight's virtual town hall about our new navigation center. I'm Mayor Carr, and I appreciate you taking the time out of your evening to learn more about the city's efforts to address homelessness. Tonight's presentation is one of several town halls we're having throughout the year to address the issue of homelessness and inform the community about what the city is doing to actively and compassionately address the issue of homelessness. Starting next month, the city will also partner with United Way and Be Well OC to host additional town halls that discuss the causes of homelessness and efficient and innovative ways to alleviate it. But tonight's focus will be on what we're doing right here, right now in Huntington Beach, and it will be broken out in 5 parts. First, Mercy House and their staff will provide an overview of the Navigation Center operations and the good work that they're doing to transition homeless adults into permanent supportive housing. Second, the city's homeless task force will address homelessness on the street level and their efforts to restore our public safety. We will also receive an update from the city manager, Oliver Chi, on current and future partnerships to tackle homelessness from multiple angles, not just through the Navigation Center. And then there'll also be an opportunity to learn more about how you can be part of the solution by volunteering or contributing towards supporting all of these great efforts. And then finally, after all of that, and I know there's a lot packed in tonight's agenda, we will have a Q&A session, and we've received lots of great questions already, but if you haven't had a chance to submit one yet, you still have time. So if you type in the comment section on either Facebook or YouTube, we will try to answer as many questions as possible. And this entire presentation is being recorded and will be uploaded to hbhomelesssolutions.com. So if you, for some reason, need to go away, you can come back and you can view this at a later time. But also go to HB Homeless Solutions as your primary source for updates and resources about what we're doing here in the city of Huntington Beach. So I encourage you to check it out. But again, thank you so much for joining us this evening. I hope you find the information tonight informative and useful. And so with that, we're going to start off the evening with a quick 4-minute video, which will give you a little bit of a behind the scenes look at what the Navigation Center looks like and introduce you to some of the staff that's participating or helping out with the Navigation Center. So let's roll the video.
The City of Huntington Beach was looking to come up with an answer in terms of how to address their street level homeless population. What can we do for these folks? We started having conversations about the development of a navigation center. Is this more than just putting somebody up for a few days? What is Mercy House's goal? And once we started talking about, really our goal is to not just simply manage someone's homelessness, but to end their homelessness. Hi, I'm Larry Haynes, and I am the CEO of Mercy House. Mercy House is a homeless service organization. We provide street outreach. We operate large-scale emergency shelters or navigation centers. And we also develop and operate permanent housing, in particular permanent supportive housing for people who are once on the streets.
Hello, my name is Miguel La Torre Munoz, and I am the program manager for the Huntington Beach Navigation Center, run by Mercy House. And I make sure that that everything runs smoothly here, like that the people get fed, that the area's clean, and that the people get housed, because that's our goal of our program, is to house the homeless. Yeah.
My name is Amber, and I'm a data specialist for the shelter. I enter in the intakes. Other than intakes, I enter any client documents, whether it's an ID, birth certificate, housing voucher, anything that has to do with the client, I just make sure that everything is up to date in the system.
Something that's cool is that in years past, there's a lot of folks who have been desperate, who've been living out on the streets, and who wouldn't come to a place like this because of obstacles, right? They maybe felt that they would be unwelcome. Or maybe they have a pet that they've been living with on the streets and they can't bring in. Well, the city and us, we figured, no, we want to remove as many barriers as we can. And so we did. So we started, we surveyed people that are in our other facilities and people on the streets, and what are the reasons you might not come to a place like this? And one after the other. Well, you want to be safe, you want to be secure, you want a place that's clean, you want to be with a staff that sees you, right? Doesn't ignore you. Somebody that's going to work with you on putting together a housing plan, because try not to get emotional, but it's like nobody's life goal was to be homeless. Life hasn't unfolded like anybody here wants it to. So how can we end this nightmare? How can we end this? And so they want to be with a group of people that will take their housing as seriously as they do. And as we speak right now, we're having conversations about, glad you're here, now let's get you out of here. And it's already happening. It's already starting to work. You're dealing with humanity, and there are sometimes no easy answers. And sometimes we have staff that have to work with that sense of despair that this is not going to be easy. And they come in every day. Every day they do it, and they do it with a smile, and they do it with a full heart, and they create miracles.
So now we've got the video, we're going to jump right into the presentation, and it's my pleasure to introduce our city manager, Oliver Chi, who will be acting as the moderator tonight as we move through the different sections for the evening. So Oliver, take it away.
Mayor Carr, thank you so much, and good evening, everyone. Thank you so much for taking time out of your day to come and hear a little bit about what's happening in Huntington Beach as it relates to our response to homelessness. We've got a terrific panel of speakers today that are deeply embedded in all of the homeless response efforts the city is engaged in. Tonight, we do have our police chief, Julian Harvey, will be joining us to talk a little bit about the police department's operations. And with him, we have members from our homeless task force, Lieutenant Dave Brzezinski and Lisa Roberts. We also have representatives from the Mercy House team joining us. Timothy Wynn, who's our Chief Program Officer at Mercy House. Also Lauren McGonigal, who is helping coordinate a lot of the philanthropy and giving to help support our operations at the Navigation Center. Everyone's here tonight to try to get you the most up-to-date info on what we're doing today, and also to try to share some details on what we're planning to do moving ahead. To begin the discussion tonight, you saw through that video that Mayor Carr introduced tonight that Mercy House is their selected operator at the Navigation Center. They've been doing a tremendous job the last month helping us get everything up and running, and they were integral in working with the city to design our Navigation Center to make sure that it was efficiently coordinated, but also would serve as a beacon through which folks could go there, get rehabilitated, and start putting a more permanent housing plan together. With us tonight is Timothy Wynn, and he's the Chief Programming Officer for Mercy House. He's been embedded in all of our decision making. Timothy is popping up on the screen there. Hello, Timothy. Good evening. Thank you for spending some time with us tonight. For all our viewers out there, you need to know Timothy's a new dad. He's got a baby at home, and he's got the parenting and bringing up all the work they do at Mercy House. Does a tremendous job for us. And Timothy's going to walk through tonight some of the operations at the Mercy House so folks get a little bit more in-depth view of what's happening day to day. With that, Timothy, we'll turn it over to you.
Awesome. Thank you, Oliver, for the introduction, and thank you to the City of Huntington Beach for partnering with us to really do our best to create solutions for the homeless folks that are in our community. We have a bit of a slideshow presentation that will introduce Mercy House and introduce what we're doing at the Navigation Center, Huntington Beach. Let's kick that on. Let's get to, I think, slide. There we go. The next slide, please. So just a primer about who Mercy House is. Mercy House is a nonprofit organization that was founded in 1989. Actually, we're a little over 30 years old now. We've been helping the homeless in Orange County ever since then. We started as just a small homeless shelter for single men, and just responding to opportunities and seeing the tremendous need in the community for services. We really are committed to creating a complete system of care that addresses the needs of the homeless, and recognizes more than just a roof and a meal and a bed, but really the human dignity of those, that there's a real cost to homelessness, that if we can create a dignified system of care, that we can really restore folks to a way of life that isn't out on the streets. We do operate programs that at every level of care, from street outreach all the way through to permanent supportive housing, with shelter and rapid housing and even prevention services. Presently, we operate across Orange County, as well as in San Bernardino and Kern counties, and Ventura County if we start to stretch up north. But we're here tonight to talk about the Navigation Center here in Huntington Beach. Here's a little, just a brief overview of some of the services that we provide. We will dive deeper into some of the details there. But the Navigation Center did open in December 2020. It's located on 17642 Beach Boulevard. It's right there, pretty close to Beach and Slater. At full capacity, we will have space for up to 174 individuals. Those folks will be divided by gender classifications. So we have beds for males, for females, as well as a section reserved for couples and for non-binary identifying folks. In addition to beds, we provide 3 meals a day, access to showers and laundry, as well as a mobile medical clinic that we partner with SOS. They'll come on and they'll be able to provide both medical and behavioral health services to clients on site. We do allow pets on site, and along with those pets, we provide veterinary services to those clients, because we view the health of those clients as an important factor to the health of the shelter. And so we really want to take care of our shelter guests as well as our furry guests. And I want to spend a little time talking about this. We also provide housing navigation services, and really the core of what we want to establish, what we view as the solution, the end to homelessness, is housing. And we know that for the folks that are living homeless in the streets, each person has their own different set of barriers that they face to housing. Some folks just need a place for a short amount of time, and they'll be able to get back on their feet and get out and afford housing in the marketplace. Other folks need a deeper level subsidy, or maybe even an ongoing subsidy. They need to be connected to maybe some kind of housing voucher or even a permanent supportive housing solution. And so what we provide at the Navigation Center, kind of why we call it the Navigation Center, is housing navigation. So housing navigation means for each client, we'll meet with them on their first day. As part of their intake, they're assigned a housing navigator, and that person will create an individual housing plan for that person. They'll assess their needs and connect them to other resources and other services in order to lower those barriers and connect them to housing. Some common questions we get about our current operations is we always get questions about security. We do have 24 guards. Sorry, not 24 guards. We have 24-hour security. There's always we have third-party security guards on site at all times. We have a camera system that monitors activity on the site at all times. We work pretty closely with HBPD, and we want to make sure that we want to operate a safe shelter, both for our guests and for the community surrounding. Part of that safety and part of our what we consider a good neighbor policy is that we don't have walk-ups. When you hear about a homeless shelter, probably the image you conjure up in your mind is a line of folks outside of the place waiting to get in. And we're committed to not having a line of folks waiting to get in. We want the shelter to be a resource to the community and not something that damage the community. And so part of that is we have a no walk up policy. All of the intakes for our clients are done by appointment only. All of the referrals come through our established referring partners. Referring partners are the city's outreach team and the local PD. And for a time, also we're receiving referrals through county referrals as well. All of the clients are screened when they come in for COVID-19. That's a question we get a lot. So everyone is going to be receiving a symptom screening and a temperature screening, and we're currently working with the city to identify partners to do actual COVID testing for intakes. Clients entering or exit, right? We also have no walk-off policy. In order to allow folks some freedom of movement, we do provide a free shuttle, right, to predetermined locations around the city. So clients, when they want to go out, they need to do their essential business. Maybe they need to go to a job interview or they need to go pick up prescriptions, something like that. They'll take our shuttle out to a predetermined spot, and then from there they're able to access public transportation or other transportation. Next slide, please. Presently at the shelter, we have 30 single men, 13 single women, and 8 clients in the couple section for a total of 51 clients on the site. This data was current as of 2 days ago. That's when I submitted the slide show for the city to make this presentation. So there may be some change from the last couple of days, but that's our current operations. Just a note, really a common question we get at that point when they hear about, oh, you have 174 beds, but right now you only have 51. Why is that? One of the reasons for that, and I want to be deliberate here, is that our intake process needs to be deliberate, right? One of our promises to the community is that we're not going to have just a crowd of homeless folks outside of the shelter. And what happens if we open the doors and we just take everybody in, that we get a rush and a bottleneck, and folks will come in and out, and that causes a situation that we want to avoid. Instead, we take all of our referrals by appointment through the task force, and through PD and through other referring agencies, and that way we're able to maximize the success of those entries. We're able to make sure those people that they're not just they're able to come in and go through the whole process. It's a surprise to many that the intake can take up to 2 hours. Intake into the shelter is kind of a lengthy and involved process. It begins with a COVID-19 assessment. There's a lot of forms that come along with intake. Part of that is, we're going to sit down with their housing navigator. We're going to talk about what are the expectations for behaviors when we enter the shelter. Right? If you're going to live in a congregate setting, it's important for folks in order to behave, according to some set expectations that will ensure the health and safety of the shelter going forward. Folks will get a shower. We're going to do everyone's laundry. We treat belongings that come into the shelter to mitigate the bed bugs and other infestations. We'll provide them a meal so that they're not hungry through this whole process. And they will, when they enter, they'll sit down with their housing navigator and take those first steps in creating their housing plan. Right? A lot of times that can be a vulnerability assessment or some other assessment to see what services they might qualify, what benefits we might need to connect them to. Just want to touch again on COVID-19 safety. Throughout 2020, we were getting a lot of questions about how we're keeping our shelters safe, right? We know that people living in congregate settings, we need to exercise extra caution. So we are doing daily screenings, including temperature checks and symptom checks. All the beds in the facility and also kind of the grounds of the facility are marked for social distancing. For example, when we place the tables in the dining area, and we mark on the ground with tape, where to stand when you're waiting, to receive food and those kinds of things. We're purposeful about the way we place our security tables and those kinds of things, so that we can really create, by design, safe distancing for social distancing. We do provide masks to all of our clients, so at any time a client can get a mask from our staff. Hand sanitizer is also provided. We have little hand sanitizer pumps that folks can get some hand sanitizer. There's restrooms around the facility where folks can wash their hands. We do have regular testing for all clients. All staff are actually required to do regular testing to ensure that we're not going to, if someone's positive, we're not going to continue to expose other people. So we are able to, we've established off-site isolation for clients who test positive, and if staff test positive, we have them isolate for a period of time until they can return after being symptom-free and having a negative test results. Just to note, masks are required for all staff and security and vendors who come on site. And again, we take the safety of our shelter very seriously, and so these are just some of the guidelines we're following, and we're going to continue to follow the guidance of public health officials as new guidance comes out.
Thank you so much, Timothy, for that overview on the operations currently as they are occurring at the shelter facility. Mercy House has been doing a great job in refining the operations and improving the operations, and the city staff is working right now to make the shelter facility a little bit more livable and a little bit more welcoming, and those efforts are really appreciated. So thank you so much.
Oh, thank you all.
The next part of our discussion really relates to, now that we do have a shelter facility here in Huntington Beach, how are we at the city managing the overall homeless issue that folks see day to day? I think there were some expectations that once the shelter opened, that maybe magically overnight the homeless problem in Huntington Beach would disappear. And certainly that's not a realistic expectation. But what the shelter does do is provide us with a new tool in being able to improve the quality of life here in Huntington Beach, where we can offer those that are most vulnerable among us the opportunity to be sheltered. But at the same time, it also provides us a tool to really improve the way that our community looks and feels as we try to reclaim some of our really sacrosanct public spaces. And to discuss with us tonight and share some details on how the city is managing the day-to-day homeless-related issues, we've got three of Huntington Beach's most engaged individuals on the homeless issue. We have our police chief, Julian Harvey. He's at the top right of the box. We have Lieutenant Dave Derzinski, who is in charge of the city's homeless response, not just at the police department, but Dave is drawn a larger circle right now throughout the city and is coordinating activities across departments to make sure we have the most efficient and effective response possible. We've also got Lisa Roberts here with us tonight. Lisa does so much amazing work. She's in the trenches every day out in the field, working with our homeless population, trying to offer them connections to services and try to offer them connections to a better, more stable way of life. Julian, Dave, Lisa, thank you all so much for spending some time with us tonight. And I think, Julian, you were going to start off the discussion and share some of what the city's been doing as we transition back to the slide deck. We're waiting for that transition to happen right now. There we go. If we go to the next slide. Really, the city's been engaged for the last 7-8 years on trying to figure out how we respond appropriately to homeless-related issues. And Julian, maybe you and your team would like to start walking us through some of those efforts historically leading up to what we're doing today.
Sure. Thank you, Oliver, for the introduction. And I just want to first say that, the model in Huntington Beach currently in place really is, it's one of the best I've seen really anywhere. And the level of commitment of resources on a city level, be it police officers and case managers, is really second to none. And then on top of that, the commitment of capital and work to get the navigation center open is another example of Huntington Beach really doing everything within its ability to address homelessness, to find long-term permanent alternatives to being on the street for our very vulnerable homeless population. So Timothy said it very well that it's just really is a system of care in the county and certainly in Huntington Beach, and the navigation center being a critical component of that system of care The police department's approach is one of outreach and engagement, a regular continuing basis, with the foundation being compassionate approach, that our outreach personnel are out there on a daily basis interacting with our homeless population to develop that trust and to communicate clearly with what resources are available, and doing it in a non-threatening manner. That's been ongoing for quite some time. And the most recent homeless count we did, I believe in 2019, put our number at about 300 individuals. And our outreach staff has contacted the vast majority of them, many of them on multiple occasions. And sometimes it takes 6, 8, 10 encounters for an individual to get to that level of trust, to make a change in their life, to even be willing to step forward and take that step to go into a shelter facility. So that's the foundation, is that outreach component. The goal is to remove any obstacles for these individuals to change their situation, to build that trust, and to do it on a personalized level. Every one of our homeless clients has individual needs and challenges, and that is the approach of outreach. Is what are those challenges? What can we surgically bring to bear to help move past those obstacles? And then, of course, I'm going to comment on enforcement. Because the navigation center is in place, the City of Huntington Beach is allowed to enforce its status offenses, which are camping violations, storage of property, curfew violations, those offenses that cause impact in our community, and as Oliver said, make very sacrosanct, limited public spaces, be it parks or sidewalks. So what the Navigation Center allows us to do, our region is under the 9th District Court of Appeals jurisdiction, and the Martin case from a few years ago said you cannot enforce those status offenses until and unless you have an alternative to sleeping on the street or in a park, that being a shelter facility. And on a local level, one of the individuals that's done some yeoman's work on this effort is Judge David Carter, federal judge here in Orange County. And he's taken all of the cases, all of the litigation, if you will, in the region under his umbrella. And he identified that of the homeless individuals in a given community, 60% is the number that he identified as. That's the number that a community needs to create shelter space for. So that is exactly what Huntington Beach has done. And it has allowed us to begin our enforcement abilities. And I know one of the questions that's going to come up is, well, why haven't you done more? The shelter opened a while ago. Why has there not been more enforcement activity? And it's important to understand that the shelter really only opened very recently. And to its credit, Mercy House is doing this appropriately, and they're doing it in a measured way, whereby they slowly bring more clients into the facility. And like I said, it's important to know what the individual client's needs are in order to navigate them on that housing plan, to identify any substance abuse issues they might have or mental health issues. This process is critical. You can't just warehouse these individuals on a mass basis and believe you're going to have success. You will not. It will fail. And so Mercy House, to their credit, is doing this in a measured, very thoughtful approach. That means it's going to happen slowly and over time. On top of this, we are in a global pandemic. And again, warehousing individuals in a structure, as you saw in the video, in a mass situation, it's just going to exacerbate the problem, and you are going to spread virus. So on top of the already daunting challenge of finding resources for these individuals who are vulnerable, we now have this virus. And so we're going about this very carefully. And coupled with that, we're looking at our opportunities in the field in terms of enforcement. And we have recently completed a very successful enforcement operation on the 8th of January, just a few days ago, where we went to 7 locations. And I believe we have a couple of slides here. We hit 7 locations which we identified as particularly impacted. As Oliver mentioned, these sacrosanct public spaces, some of them very visible, some of them not as visible. But we went to those locations not only because of their visibility, but really about complaints. So when you are a resident and you live next to a public park, that public park is a resource that may have driven you to buy that house or move to that house or rent that house with the expectation that you have access to that park for its intended use. And when that intended use is impacted by homelessness, it affects your ability to use that resource. And so the public spaces are our #1 focus of effort. And as you can see by these slides, every one of these ended up in either an individual being located into the shelter, or we found individuals we weren't aware of. We had outreach opportunities. We did make a few arrests. One was for a felony, a crime that had occurred the previous night, wherein the individual committed a burglary. A couple of others went for camping and some other arrests. But this is an example of strategic surgical enforcement, not on a grand scale, but on a smaller scale. And this was only done after repeated contacts with these individuals, letting them know that this was no longer a tenable situation, that enforcement was coming. So there was ample opportunity for them to avail themselves of resources before we took enforcement action. Enforcement is a key component of the system of care, that there needs to be a disincentive to simply residing in our public park space, sprawling all of the material out in a large area. So it will help us in our bringing the system of care to bear in order to reduce the number of homeless individuals and bring the most services we can. Let's see. Future enforcement actions are going to follow that same formula. We're going to go where the greatest impact is. It will be measured, and it will only be done once the individual has been contacted multiple times. So there's no surprises, there's no secrets. They know exactly what the rules are. And it's important. They will, either avail themselves of shelter, they'll change their behavior. But what we want is them to stand up and say, yeah, I'm ready to make a change in my life. And this is no longer the solution for me. That's what we want. Next slide. Let's see here. This is our committed, when I talk about committed resources, we have 4 full-time police officers that do nothing but address homelessness in our community, along with full-time case managers. And currently we are about to fill one of the vacancies there. As you can see, these are all city employees, which is a huge benefit for us. We're not relying on a vendor or a contractor. Please come do outreach when you can. We have complete control of what we do, where we do it, and when we do it. So I cannot emphasize enough the level of commitment the city has made into this problem. And I know a lot of people watching right now are saying, well, the problem isn't solved yet. And it's important that everybody watching understand that for the foreseeable future, our role as government is going to be to manage this problem and this very complicated social issue, to provide resources to everyone we can, with the goal of those people finding alternatives, whether it be going back home, whether it be finding a long-term solution, whether it be in a congregate setting. The Navigation Center is a key component of that. But as someone mentioned earlier, I think it was Timothy and even Oliver, that the housing is a part of that continuum of care. Next slide. Is that it?
Yep. Thank you, Chief. And I think that's an important distinction that needs to be emphasized. And that distinction is, with the shelter in place, we have an enhanced ability to help and an enhanced ability to start reclaiming some of our public spaces and to improve the homeless situation as we see it in Huntington Beach. But realistically, this is an issue that's plagued society since the start of time. We're not going to end homelessness in Huntington Beach tomorrow. But aspirationally, now that we do have the shelter in place, it provides us not just with the tool to respond day to day, but it really provides us with a chance to think about additional things we might do to try to achieve that aspirational goal of ending homelessness here in our community. And if we go back to the slide, I think Chief Harvey and I were planning on sharing some of the additional response plans that we've been thinking about. Now that Dave and Lisa and our homeless task force have that tool of being able to enforce certain quality of life regulations, what else do we need to do to try to make proactive changes so that our homeless response is as effective as possible? And that really requires us to dig down into thinking about the root causes of homelessness. When you come across someone who is homeless, what you almost inevitably always find is there are mental health issues and there are addiction issues. And there's issues as it relates to access to housing. Now, here in Orange County, we are blessed with having abundant resources. One of the things I think we wanted to share with everyone tonight is that those resources aren't being efficiently deployed. And if we're going to make further dents to improve the homeless situation, now keep in mind there's nearly 7,000 homeless people in Orange County tonight that will be sleeping without shelter. And if you just look up across the way in LA County, there's almost 60,000 people homeless. What can we do to try to start improving that situation moving ahead? I think one of the things we can do in thinking through mental health, addiction, and housing issues is let's start trying to use our resources a little bit more thoughtfully. Chief Harvey, I think you wanted to share some details and some statistics regarding mental health homeless response resources here in Orange County. I think this slide highlights some of those details you wanted to talk to everyone about.
Thank you, Oliver. Yeah, that's I know everyone recognizes the impact of mental illness in our community, but some of these data points will bring that home. Is the Huntington Beach Fire Department makes more than 1,000 transports annually, where they're driving homeless individuals to the emergency room for various reasons. That's a significant number, and it's not just one fire employee. There's multiple fire employees with a piece of apparatus taken out of the field for those purposes. About 13% of the calls for service the Huntington Beach Police Department responds to annually are related to mental health or homeless type issues. 2,500 calls for service annually related to mental health, 14,000 calls for service annually related to homeless issues. Those are just going up. They're going up every year. And across Orange County, 50,000 admissions to the emergency room for mental health issues. It is a complete crisis, and we have to recognize that a large percentage of our homeless population is suffering from chronic mental illness. Now, to its credit, the county has made some significant changes in the not so recent past. And I don't know if we have a photograph of the Anita Street facility, but I want everyone to know it's hope is on the way. I'll just cover a couple more statistics if you go back to that slide.
Right. Well, and I think, Chief Harvey, the point in all of this is that all of the response to homelessness, it costs a ton of money. And that's one of the constraints to solving some of the homeless related issues we have is it costs a lot to address these situations. And just a couple of years ago, the United Way, they conducted a landmark study for Orange County trying to equate the cost of homelessness. How much does it cost to provide care to the existing 7,000 homeless folks that are in Orange County? And what that study found was really shocking, that the amount of money we are all paying collectively as a society now for healthcare, housing, and criminal justice system costs to respond to homelessness, we were spending $121 million per year in 2014-15. The study also outlined that the average annual cost in responding to homeless related issues per homeless individual was about $45,000. And the really, I think, interesting part of that study was that it found that you do have a propensity of high impact users of health and medical services. The study, as it went into the more granular data, found that if you could eliminate the 10% of top users in the homeless community from the health and mental service facilities here in Orange County, that average annual cost would drop exponentially. It dropped down to about $10,000 per person. And I think what all of that means, the stats that Chief Harvey mentioned, the studies as relates to costs, what it all means for us tangibly is there are certain things we need to continue doing on a day-to-day basis here at the city to respond to homeless issues that we're seeing. Work that Chief Harvey, Lieutenant Drzinski, Lisa, the rest of our homeless task force that are doing every day, we need to continue those efforts to respond to what we're seeing out there in Huntington Beach. But we also, if we want to make a dent and not just keep band-aiding over the issue, we've got to find a way to reallocate some of the existing resources that we are spending right now, some of the money we're spending right now, to develop better mental health and addiction response strategies. And then in the background, while that's happening, we do need to increase our supply of available affordable housing. And I think what Chief Harvey was mentioning is there is hope on the way. And here in Orange County, this statistic actually shocked me. Up until a year ago, did you know across the entire county, a region of more than 3 million people, the county had a total of 15 crisis stabilization beds for the entire county, 15 serving a community of 3 million. And as Chief Harvey said, there's been a chronic underfunding of mental health and addiction related resources here in Orange County and across the country, really. And if we go to the next slide, the hope that's on the way, and Julian, maybe you can talk to this a little bit. It's a collective that's called Be Well Orange County. Julian, maybe we'll turn it back to you here to walk us through what Be Well is, and as we move forward, what's really planned in Orange County moving ahead, and how we can access some of that here in Huntington Beach.
Yeah, thank you, Oliver. So the Be Well Orange County is the hope that Oliver's talking about. The majority of my career in policing, we were dealing with those 15 crisis beds, sometimes fewer. And what everyone needs to understand there is that means that any facility is only going to be able to keep the very, very sick and the most dangerous individuals in our community. For everyone knows the 5150 72-hour hold, right? Everyone knows that number. Well, that's really not that accurate. Unless you're an absolute threat to the community, you're not going to be held for 72 hours. You will be out sometimes in a matter of 8 hours. Again, it comes down to there's simply not enough room, and they have to prioritize. And those that don't meet that very dangerous threshold will be released back into the community. So what the Be Well program initiated, and this is not, I'm not saying this to be dramatic, but it is this is the example, the greatest example I've ever seen of a nonprofit / partnership with government in my 29 years in policing. It is a remarkable institution that has been opened in the city of Orange, and Be Well OC was the entity that made it all happen. And it is a crisis stabilization center where our officers can drive an individual to with a secure Sally Port. There is a sober entrance, and there's a sobering entrance where once the officer gets there, they have the ability to quickly introduce their client to the staff there, and then the officer leaves. And so it's important to understand why this model is so much better than the current model is when officers come upon a mentally ill individual who is in need of evaluation. The current model is they take that individual to an emergency room, 2 officers. So 2 of our officers come out of the field, instead of responding to calls for service or preventing crime, they come out of the field, they take this individual to an emergency room, sometimes for 3 or 4 hours, whether there's a bed or not. They wait on a team from the county to get there to do an assessment. They can't leave because if they leave, there's no secure situation in the emergency room. Otherwise, it creates a hazard for the staff there. So they're tied up there for sometimes a third of their shift. And again, at the end of this, there's often no resolution. Sometimes the person does get a hold, sometimes they don't. This model allows those officers to go back in service where others better suited better capable with better training can then take that individual and bring to bear all the resources he or she might need. And so this model is tremendous. It's not going to be the solution. We're going to need several of these facilities throughout the county, but it turned that 15 beds into it more than doubled it, tripled it really overnight. And so it's a huge resource. It will not solve that problem, but it's going to be a big help. And it's an example of a better way to do things. And I think that's going to then morph into the mobile approach that we're going to talk about here shortly.
Yeah, and I think to build on what Chief Harvey was saying, if you think back again to some of the statistics that we described just here in Huntington Beach, over 2,500 calls per year for mental health services, over 14,000 calls per year for homeless response. That's nearly 17,000 calls for service that our police officers are responding to, where you really can't resolve the issue. You can't solve the problem. And that sucks up a tremendous amount of police resources. It also sucks up a tremendous amount of emergency room resources. The Be Well regional campus model, what Be Well will be doing is the first of those facilities, like Julian described, is opening this month in the city of Orange. There's 2 more regional campuses being planned. The next one will be built in the city of Irvine. They're looking right now for a 3rd facility site moving ahead. But even after those 3 regional campuses get built, we still won't have enough access to addiction and mental health resources to meet the need. All of those facilities, even before they're open, they're already full because of what we see every single day in the field with our community here in Orange County and in Huntington Beach. And so one of the responses to that Chief Harvey has been leading for us really is mobile crisis response. And that is a critical part of this mental health and homeless response ecosystem that has to get matured moving forward. Under that mobile crisis response, really what it is developing a new tool for us to use in responding to homeless related issues, intoxication issues, substance abuse issues, dispute resolution, mental illness, anything where it doesn't require a police officer or a paramedic. Can we develop and design a different response model to be able to handle that particular service need? And if we can layer in enough of these different services between what our homeless task force is doing on the ground every day to address the issues we see on the street with homelessness, if we can layer on the regional wellness campuses so that there are places for folks to access sobering facilities and also get the mental health care they need, and then you layer on an additional level of service with the mobile crisis teams where you can stabilize folks within their home so that they don't get onto the street. That's now making a dent in trying to solve the broader issues that are impacting homelessness. And Chief Harvey, maybe you can talk a little bit about this Cahoots program that you've been helping us examine that can, as we move ahead, I think really serve to help us in Huntington Beach.
Yeah, so the Cahoots model, Cahoots Crisis Assistance Helping Out on the Streets, is a model that was established actually the same year that Mercy House started in 1989 in the city of Eugene, Oregon. And there's an image of it there. They pair an emergency medical technician with a mental health service provider or practitioner, and they respond in the field to calls involving mental illness that are non-violent, non-criminal, and we did a quick analysis of the number of our calls. We think that about 15%, maybe 20% of our mental health calls would qualify for this model, where don't need a police officer to go to those calls. And as Oliver mentioned, the categories are pretty broad and include a lot of things: crisis counseling, suicide prevention, assessment and intervention, conflict resolution, substance abuse, first aid. There's a lot of calls we go on. My son or daughter is behaving irrationally and they're a paranoid schizophrenic diagnosed. Please help. And we go and we send 2 officers and we go and we deal with that call for sometimes hours. We're dealing with the family and the client. Sometimes they're voluntarily willing to go. for evaluation. Sometimes they're not. Sometimes they don't meet the threshold for 5150. And so, but again, we're pulling police officers out of the field to deal with these calls that we're less equipped to come to a successful resolution. So the Cahoots model has been successful for 30 years in Eugene, Oregon, and we're looking at that model to bring to bear here in Huntington Beach, where for far less cost, if you look at the dollars per hour of police officers, you could bring these individuals, respond to those calls, and stabilize, bring immediate stabilization to the situation. And the biggest component I see as beneficial is the case management follow-up. So when they're not responding to a dynamic, in progress, acute call for service, they're going to be following up on their Huntington Beach clients that they've responded to in the past, the 10% that Oliver mentioned, the ones, the high users. And they're knocking on doors, they're talking to family members, how's Susie doing today? How's Johnny? Is he on his meds? Have there been any outbursts, where they can almost prevent a call from ever happening in the first place? And often when police companies call dressed like I am, we're the catalyst, where someone who would generally not be prone to violence, when we show up, we provide that catalyst, and now there's a chance for a violent encounter. And because we're there, we have to use force sometimes, and not by our decision. It's just that's the situation. So if we can avoid that, it's always a better resolution. So we've drafted a model, a very rudimentary plan of what this would look like. And you're seeing this replicated throughout the country. And I think this is going to be a model that would greatly benefit this city.
No, thank you, Chief Harvey. And we can start layering on different tools so that we can respond to each of the different pieces and components related to homeless related issues, all of the contributing factors. That really gives us a chance then to start making a difference, a tangible difference, where the work of the Homeless Task Force isn't going to be just cycling the same folks in and out of the shelter facility. It's going to be an opportunity to stabilize folks in their home where it's possible, so those folks don't become homeless. It'll be having access to regional mental health and addiction treatment facilities that Be Well OC is putting together to, again, prevent homelessness from happening, and to continue the efforts of our Homeless Task Force, because we are going to continue to have homeless folks throughout Orange County. How do we make sure that when we see those folks, we get them access to the best care possible for those that want help, for those that refuse help? Let's find a way to mitigate the impact then on the broader community. Now, one of the last components, we won't spend a lot of time talking about that tonight, that we hit on is the need for more permanent supportive housing. And here in Huntington Beach, that's the third component of chronic homelessness that we need to address outside of mental health and addiction issues. And here in our community, I think what we wanted to share is Mayor Carr and this city council have really prioritized making sure that we're advancing and finding as many permanent supportive housing projects as we can. And we're really proud of the fact that we are going to be developing the city's first permanent supportive housing project. It's a 43-unit project that Jamboree Housing is going to be building for the city. It's located at Beach in Maine, just behind the Denny's facility, located at that current vacant parcel of land. In fact, at our council meeting next Tuesday, we'll be finalizing the affordable housing agreement with Jamboree to make that project a reality. Now, developing permanent supportive housing is really expensive. And one of the things Huntington Beach, I don't think, gets enough credit for is the fact that we're one of the few cities in Orange County that has an existing inclusionary housing ordinance. And what that is that's a rule that anyone that's looking to build new housing units in Huntington Beach has to set aside units for affordable components. Now, we're currently at the staff level under Ursula Luna Reynosa's direction in our community development department of making some tweaks to that inclusionary housing ordinance so that as future development comes online, those developers will have an opportunity to pay an in lieu fee to the city, so we can use those funds to leverage and build additional affordable housing moving ahead. Internally, we're looking at a couple of larger projects that we'll be excited to bring forward this next year, but really developing additional housing stock is another component that we need to focus on if we're going to try to achieve that aspirational goal of ending homelessness here in our community and region. As we move into the last segment of our discussion, I wanted to bring back Lieutenant Derzinski and also Lisa Roberts, along with Lauren McGonigal, the Associate Development Director from Mercy House. Because I think what we wanted to share with the community is, what do we do now? And I think what we've seen here in Huntington Beach is just an overwhelming support from the community, overwhelming generosity, and wanting to be part of the solution and wanting to be part of the effort to address homeless-related issues. And tonight, Lauren and Lisa and Dave are going to spend some time talking about some of what we've seen the last couple of months since the shelter has been open, and also how you can get involved if you feel compelled to help give or support our efforts here. How is it that you can get involved? And with that, Dave, maybe we'll turn it over to you to get started with Lisa, and we'll walk through some of the opportunity the community has to be part of this effort.
Absolutely. Thank you, Oliver. Yeah, the city and the Huntington Beach Police Department have really been working diligently for the last 5 years when we started our program to build a framework. And we've learned, we've stepped on it a couple of times, and we've really developed a system where people communicate their issues to us, get feedback so that they know that we're out there listening to them and resolving some of these issues. So before I pass it up to Lisa, go to our website after this and you can see ways to report issues. We really try to limit it just to phone calls, email addresses, and MyHB to keep it simple. And that goes directly to our homeless task force officers and our case managers. And they generally get back to you very quickly and let you know the outcome. And there is a lot of information exchange because this is such a complex issue that we will keep working on it, refining it, and working with all of you to find those creative solutions, to find those quality solutions, while implementing compassion and helping everybody get through whatever their barriers are. Lisa, do you mind touching on some of the stuff we do with our case management?
Sure. One of the things that I think is important to mention is that our team does do some fundraising efforts through Coast to Coast Foundation, and that allows us to be really flexible and to pinpoint ways of assisting people who have barriers in getting into shelter or getting into housing or addressing whatever the shortfalls they may be experiencing. So we've used those types of fundraising opportunities to do things like order birth certificates from out of state, to perhaps reunite people to with family members out of state. So we use it to buy train tickets or bus tickets. We've used it for people who are submitting rental applications, but maybe they don't have the money for the fee, deposits, moving vans once they do locate housing, things as simple as even getting reading glasses for people who needed assistance in that way. So it really gives us an opportunity to pinpoint very specific needs that we don't otherwise have funding for. So that's something that people can donate directly to Coast, and that gives us a lot of flexibility. Also, another way they can support our efforts is if they are interested in being kept abreast of the activities and the success stories of the task force, they can sign up on the website for our newsletter. And that gives some very specific stories of the activities that we're doing.
Lisa, Dave, I think there's a slide deck, right, that shows some of how folks can contribute to Coast. Maybe if our programmers can get us to that slide. I think it's the next one up. Yeah, there it is. Dave, Lisa, there's some contact info there. Would you like to chat with folks? I think there's an online website where folks can log on and donate money or time if they'd like to.
Sure. Yeah. So that link there on the website will take you directly to the partnership that we have set up with Coast to Coast in our police departments specifically. And then you can also contact my fellow case manager, Christy Conway, and her email is listed there if you need to set up a different alternative way of making a donation.
Terrific. There's also folks that have wanted to be part of the effort at the Navigation Center in supporting the work Mercy House is doing. Lauren, maybe you can walk us through a little bit if introduce your role in Mercy House's platform, some of the work you're doing for us here in Huntington Beach, and describe if folks want to get involved, how they can do that in working with you.
Yes, thank you, Oliver. It's been just so incredible to see the community support that's happened. Really grassroots wise, I mean, my name and my email address has been thrown out a few different places, and already we've gotten, dozens and dozens and dozens of people donating and looking to get involved. So the City of Huntington Beach is just overwhelmingly generous. We're super grateful. Just some quick logistics. I am the contact for all donations. This, pretty much means everything that you would want to bring to the shelter. It needs to go through me. We don't take any items that are dropped off without coordinating with me. That's simply because of storage, and we just want to make sure that the team on site is ready to accept those donations. And so as you can see on the screen, we're able to accept hygiene items, gently used adult clothing. Obviously, this is an adults-only shelter, so we don't have any use for kids' clothing or anything like that. We also do accept meal donations. This is a little bit different in COVID times. So if you're looking to donate a meal, particularly cater a meal, definitely get in contact with me. That's something that is really great for our clients to kind of have a variety of different meal providers. And then lastly, we accept miscellaneous donations, books, puzzles, games, other activities. We're trying to make this a place where people can obviously work their housing plan and go to their appointments and do all of that good work. But this is also where they reside and where they live, and we want to make it comfortable and enjoyable for them. So my rule of thumb is if you have any questions, just email me. There's certainly times where we'll need more obscure things, or people have things that they want to donate. So just get in contact with me and I'll be able to let you know if we're looking for that. For monetary donations, you can donate to Mercy House, and I'll just say that as was previously communicated, if you have a passion for supporting the Homeless Task Force and the various tasks that they do, certainly donate to Coast to Coast. That's the easiest way. If you're interested in the work that Mercy House is doing and want to contribute maybe a larger sum to shelter operations and different things that go on in the shelter, you can certainly do that by donating to Mercy House. Just make sure to write HB Navigation Center as you send in a check, or classify that when you sign up online. And then I think we also have just a line on that slide about volunteering. Volunteering at the Navigation Center. So we are currently accepting applications. However, we do not have any available opportunities. And this is just very simply due to COVID, based on the max capacity of a lot of our places, and just, not wanting people to congregate and not really having an effective system yet of making sure that volunteers are following all of the COVID protocols. We are not quite ready for volunteers yet, but volunteers are the lifeblood of Mercy House. We appreciate our volunteers so much and are so grateful for them at our other shelters. And, so when it's not COVID, we're looking forward to welcoming tons of you guys onto the site to, really just serve our clients and come alongside us as we provide services to our guests in a variety of ways. So that is coming. If you are interested, please register on our website and we will let you know when those slots open up. We are, doing everything we can to make that happen sooner or later, but COVID is a reality. So yeah, I'm your contact for all of that stuff. Would love to get to know you guys and be as much help as I can as you're looking to get involved with the center.
Thank you so much, Lauren and Dave and Lisa. And at this point, I'm going to ask our moderators if we might bring back Mayor Carr. That really wraps up the formal overview. We hope that the presentation and the discussion tonight provided a little bit more context on what the city is doing right now to address homelessness currently, how the Navigation Center is functioning, and also painted a picture of where we're headed as a community, moving ahead while we all work towards that aspirational goal of ending homelessness. At this point, I think Mayor Carr will turn it back to you as we get into the question and answer session.
Yeah, we have lots of questions that people submitted before this town hall, and we have received more questions via Facebook and YouTube of people submitting on their comments. But I just really wanted to touch upon what Lauren said of how compassionate and thoughtful and caring this Huntington Beach community is. So it doesn't surprise me at all that you're getting overwhelmed with volunteers who want to donate and be a part of the process. And I think that's really one of the things that makes Huntington Beach such a beautiful community, is that we are a community that comes together and helps one another. So again, very grateful for everybody's participation tonight and being part of this town hall to get the information out to our residents about what we're doing. So with that, I have, we're going to take questions till 7 o'clock, so I'm going to try to get through as many of them as possible. And so, Timothy, I'm going to start off with you. Here's one of the first questions. On average, how long does it take for a homeless client to go from the navigation center to permanent supportive housing?
Question to answer. I touched on it earlier. There really is a really wide range of amounts of time that it could take, and each individual person's case is going to vary. So we and part of our philosophy of service, we don't see value in putting a timer on somebody as they come into the shelter. A lot of times folks want to know about, like, what's the longest time someone can stay in the shelter. And if someone is actively working their housing plan, if they're working with their navigator and lowering those barriers, and let's say, we don't want to say, oh, sorry, it's been 91 days, and so now you have to, you can't be here anymore. If they're making the right steps and they're working their plan, we're going to continue to work with them until they get housing. And there are extreme cases in both directions. Sometimes we get someone who's in there for, as few as 10, 14 days. Maybe they come in, they already had a job, but they just didn't make rent or something like that. And we've had some cases where, clients have stayed in our shelters for, over a year, but we're eventually matched to permanent supportive housing, and we're able to leave their homelessness behind them forever. So we get extremes on both sides. If you take an average length of stay, it tends to be around the 90-day mark, right? But that's, again, that's kind of tough to really say how long does it take for someone to go from homeless to housing. That really is the kind of question you have to analyze on a case-by-case basis. And really, I think the largest determining factor, the one thing that would reduce the length of stay, that would make a faster transition from homelessness to housing, is we have an obvious bottleneck at the landing spot. Right, we have the thing we need to provide faster, to provide shorter length of stay in shelter and increase successful placements is more housing resources for folks to get connected to.
Mm-hmm. Well, that kind of leads into the next question that we got from our residents. What would happen if somebody doesn't achieve permanent supportive housing? What are the options available for somebody that maybe we're having difficulty placing?
Mm-hmm. And so I want to be a little careful with this question, because it sounds like they're asking where do people go if they're unsuccessful. And so really, we let's be honest, we do have some folks who will leave the shelter unsuccessfully, and if we know where they're going, sometimes they may say, I'm going to go crash with a friend, or they may they may return to the streets, they may return to homelessness. Some other places the folks leave to, so we have sometimes folks will be able to connect to a transitional shelter, right? So that's not, we don't count that as a permanent housing. Sometimes they may have a tie to another geography, and they may connect to another shelter somewhere. Sometimes we're able to reestablish family ties. So sometimes folks will say, I can stay with my mom, but she lives in another state, and we are able to do what we call shelter diversion. So we're able to connect them, as long as we can verify that they're going somewhere. We can connect them to what we call a diversion placement. We'll divert them from our shelter into permanent housing somewhere else. But so there are a lot of other places.
So this next question I'm going to throw out to the chief and to Dave. What else are you doing to make the city safe from panhandlers, homeless in the medians, just people who are asking for money out on the street?
That's a good question, and I'll let Dave answer the second part. But the laws are tricky. When our ability to enforce panhandling when someone is on a sidewalk, there was a case where it was determined to be First Amendment activity, believe it or not. But if they're in a traffic median, it could create a traffic hazard that is easier to enforce for us. So we will respond. We want those calls. We encourage people to call us. That's how we know where the issues are. So, but I'll let Dave comment further on the panhandling.
Yeah, the laws are certainly a big part of it. One of my roles as the coordinator is to work with all the city departments to look at these issues, whether it's bring in motor officers to deal with the traffic issues or people standing on the median. Our city has a lot of fatality accidents, some of which involve a pretty good portion of our homeless population. So we certainly want to deal with that much more. Encouraging businesses to not provide things that make it comfortable for the people. People tend to gravitate towards where they can get food and money and socialize with their friends and enjoy the view. So we definitely want to make sure that people are following all the rules. We've increased signage with Public Works. We've had more of our police resources out in the field. You'll see a lot more of that take place over the coming months with our different operations and outreach efforts. And that's just the tip of the iceberg of some of that stuff. But really, what we really need to do is have the public notify what the issues are so that we can track where they're occurring, when they're occurring, and be very responsive to those. Sometimes
Mayor, if I may, it's also a supply and demand issue that we want to get the word out, educate the public that the reason they're standing on that corner at that off-ramp is because people often give them money. Mm-hmm. So it's not helping our cause, not helping the system of care. So for everyone watching, please tell your friends that's not helping them. The reason they're standing there is because one out of X number of cars will give them some money.
Right. So that's good advice. I'm gonna keep you two on the hot seat for another question here. When an encampment is cleared, why can't the people living there be taken immediately to the shelter? It doesn't seem easy for a homeless person to find a case manager and begin the process of qualifying to use the shelter.
I'll take that one. So when we come out and do a clearing of an encampment, the case managers are always with us. So there will still be an opportunity for people to step up and say, yeah, I'm interested in shelter. But again, these are usually individuals we're accustomed to, or what we know their individual needs, and we've had multiple opportunities to have them located in the shelter. But it's not mandatory. They do not have to avail themselves of the shelter. It's a voluntary situation. So, when we go in there and we know this person has been camping in a public park for multiple days, and they've had every opportunity to avail themselves of these services, there are times when we will take enforcement action, and that could mean an arrest for camping.
Okay. Dave, did you want to add anything to that, or pretty much? Okay, so this next question is really for Lisa and for Dave. Who qualifies to enter the Navigation Center? And for those who do not qualify, where can they go to obtain shelter and resources?
Or maybe sure, I can take that. So in order to be eligible for the shelter, people need to have recent, significant, and verifiable ties to the City of Huntington Beach. Typically, that would involve something like recently having lived, worked, attended school, having children attend school in the city, things like that. We're pretty flexible as far as assisting them in terms of providing verification for that. We've made calls to employers, things like that. So it's not that difficult if there are ties. As far as people who do not, well, first let me go back. If they do meet those eligibility requirements, they do also need to be screened for any open felony warrants are not permitted, and individuals who are registered sex or arson offenders are also not permitted in the shelter. Lastly, we don't take families, as you probably know. We only deal with individuals and couples. So families, we are an access point. The Homeless Task Force is an access point for families. So if we come across a family who is in need of shelter, we can refer them to an appropriate shelter in the county that's set aside for families. And as far as the other individuals we mentioned, if someone does not have those ties or does not otherwise meet the eligibility requirements, we have other resources. We can redirect them to the city or area that they might be more tied to, or we can also provide them with referrals to places like the county, who, you know, Outreach and Engagement has some beds set aside in our shelter, as well as other shelters in the county, that they can work specifically with those people.
Mm-hmm. And I think that's a good point when you mentioned another question that we had is, where can women and children go? So you did mention that you're still a resource that they could use, but they wouldn't be they wouldn't be sent to the navigation center, but you could definitely point them in the right direction.
Absolutely. We do work with families all the time. And like I said, for people who aren't interested in shelter at all, we still have plenty of other ways that we can assist those people. And that's something we do every day, as although we are very excited to have a shelter as one of the tools in our toolbox now, we've been doing this job without a shelter for years. So we have lots of pretty well developed resources that we've been referring to.
Great. Thank you. So the next question I have is about bicycle chop shops. And the residents want to know, why aren't the police shutting them down? And they know it's common knowledge to the residents. The locations and photos are constantly posted on the internet. But they feel that this question basically is saying it feels like there's not a lot of action to shut down these bicycle chop shops. So I don't know if the chief wants to take this, or maybe Dave, you want to take this one?
Well, and I'll start, maybe then kick it over to Julie and Kim. One of the things that you and the council should be commended on is we recently did approve an ordinance that basically outlaws bicycle chop shops on any public property. And in fact, one of the reasons you haven't seen as proactive enforcement really has been efforts diverted to getting the navigation center stood up. What I will share is that Chief and Dave can provide a little bit more details, but our January 8th enforcement action, actually one of the sites that we cleared, we did use the bike chop shop ordinance in order to clear that particular encampment. And as we move forward with a more mature navigation center and a more mature enforcement posture, we're definitely going to look for the bike chop shop locations and where they exist on public property. Those will be restricted and those will be taken down. Chief Harvey, I'm not sure, and Lieutenant Drzezinski, anything else to add to that?
I think you covered it pretty well, Oliver, that when we do an operation like this, we bring multiple resources out there. And on this last one, we had our homeless team, we had additional officers from patrol, we had detectives there who would take the investigative lead on the chop shop, and they were there and they took action on that one, actually in Sunset Beach. So again, the good news about Huntington Beach is it wasn't just police out there. We had public works trucks, we had a dump truck, we had public works trucks that take the property to a facility where it can be stored for a minimum of 90 days. So the good news about Huntington Beach is the vast resources that we can, at a moment's notice, bring to bear. But Dave, anything more on the chop shop?
No, and also Oliver mentioned it was a new thing. So that last effort that we had on Friday was a good run through of that, and more resources will be rolling out as we start learning all the different locations. I got an email today that there's another one set up at Harriet Weeder Park. We'll be out there soon enough. Just know that when people post this stuff on social media and it makes the rounds, it doesn't necessarily end up in our laps. So if you call us or email us or use the MyHB, it will really go straight to us, and we can get them literally within hours.
Right. So posting it on social media is not the most efficient way. Reach out to you using one of those apps, and then we can actually get going on it right away. Okay.
Absolutely.
So the next question I have is, I'm going to kick it back to Timothy here. How many beds have been set aside to be used by the county since we do know it is a partnership with the county, and how many of these beds that are reserved for the county are currently in use?
So as I understand, the county is contracted for a reservation of 30 beds at the Huntington Beach Navigation Center, and presently 6 of the clients that are there at the shelter came from county referrals.
Okay. This next question I'm going to give to Oliver. One of your favorite things to talk about is funding.
Oh,
so,
yeah.
How does the city plan to fund the ongoing operations at the shelter? And will the use of COVID-19 and SB2 funds for the Navigation Center be available for related expenses, and will they stand up to an audit?
Certainly. The short answer to the second part of your question that was asked, Kim, is yes, we've spent all funds that have been expended to get the Navigation Center stood up, was and will stand up to an audit. We have some terrific folks working in the finance department helping to make sure that we're following all the proper protocols and guidelines. I think the city council really needs to be commended too, that establishing a shelter is an expensive proposition, and it's challenging to get a shelter stood up. And we used actually multiple funding sources to get our Navigation Center established. What's really important to note is we haven't used any general fund dollars to get the shelter stood up, and we haven't used any general fund dollars to engage Mercy House to operate the shelter. We used about $6 million of our low mod housing funds to acquire the property on which the shelter's built. We used about $5.2 million to go ahead and get the Navigation Center constructed. That was using CARES Act money that we got from both the state and the county. So in order to buy the dirt and also stand the property up, we spent a little over $11.5 million bucks, 0 of which was city general fund money. And on a move forward basis, our operating contract with Mercy House runs about $2.5 million per year. We're using a combination of CDBG and also SB2 funds locally to be able to address that resource need. So on a move forward basis, we feel like we've got a good financial plan for making sure this is sustainable. And really, I think given the priority that it is, here in Huntington Beach, it makes sense to prioritize and spend resources. Even if we had to spend general fund dollars, that probably makes some sense to consider given the scale and importance of fixing this problem for our residents and for us here in Surf City.
And absolutely, it is one of the #1 priorities that we hear from residents on a regular basis. And so it is a top priority for the city, and it does make a lot of sense to continue to put all of our efforts behind this project. I really love this question, and I applaud the resident who submitted it. And I'm going to give this one to Timothy, but maybe Lisa wants to chime in on this one as well. Is how will you measure the success of the Navigation Center?
So one of the main measures of success that we use across actually all of our programs is the number of permanent housing placements that come out of the shelter. So that is our ultimate goal, right? The shelter, the existence of the shelter or enrollment in the shelter, those are not the solution to homelessness, right? Those are the first step, right? It's a tool and toolbox, as Oliver said. Really, our measurement of success is how many folks can we place into housing? For how many people will we end the homelessness?
I love it. This question is also going to go to you, Timothy. Since Mercy House is a nonprofit with a Christian background, do clients also need to be Christian to be admitted into the Navigation Center?
That's an important question. We were founded by a Catholic priest, Father Jerome Karcher. He actually is the pastor or the priest of a church that's not very far from Navigation Center itself. And that's part of our history. And I think that the expression of faith is something that a lot of folks have in seeking to help the community and seeking to participate in some kind of service in what they do. However, at the same time, we have no obligation for our clients In fact, we're pretty strict that there is not to be any proselytization or any requirement of faith in any of our programs in order for clients to receive the benefit of our service. It's really important to us that that we recognize the dignity in all of our clients, regardless of their faith or the color of their skin or any of those other kinds of factors.
Great. Okay, so this next question is going to be for Lauren. As far as volunteering, what areas can a volunteer make the best impact and the most impact? So tell us what you need, because as I said, this community is here to help. Oh.
You may be muted.
Sorry, I was muted. I would say if we are not taking COVID into factor, so I've already expressed that pretty much during COVID times, volunteers won't be super, or volunteer opportunities won't be available at the shelter. Donations are a different thing. But, beyond COVID times, volunteers really help at every kind of avenue. We have volunteers that are serving meals, that are, helping with some of our facility kind of tune-ups and cleanups and everything like that. But really, I think something that will be so exciting post-COVID is for groups to come in and host different, events or different things for the clients to participate in. Our clients, especially at the Huntington Beach shelter, obviously, they haven't been experiencing a ton of, fun or enjoyment because of COVID. Events are canceled. They can't go to all the places that maybe they would have gone before. So we're really excited to welcome in groups. I've already had tons of conversations with groups that have ideas for, ice cream socials, pizza parties, taco nights, game nights, art and painting nights, all those different types of things. So, beyond just the regular volunteer opportunities, I'm very, very excited to welcome folks in once COVID is over. To really just connect with our clients and really just put on some activities for them that can hopefully lift everyone's spirits after this time of isolation. But volunteers, there's a variety of different options, job kind of skill seeking, whether people have, skills in resume building or job coaching. Really it just depends on what people are passionate about.
May I add something here also? As we've opened up the Navigation Center at Huntington Beach, one of the efforts we're currently doing at the space is to kind of soften it, right? With the new constructions, new buildings, there's lots of fences and those kinds of things. And one of the things that we're looking to do is to try to create some kind of day activities or things that folks can do while they're being safer at home. Right, while they're isolating in that space, if they're not able to, leave this space and engage in other activities. So I understand we're going to be shortly going to be creating kind of a website to, or maybe posting on the website that exists, some needs that we're looking for. So if you want to organize, maybe your peer group or your friend group or your community group to help us meet some of those goals, I know that's a need that we'll be posting shortly. I know that some of those things might include, planters and maybe some kind of yard games, those kinds of things that, or maybe art pieces, those kinds of things that will help really humanize and really kind of to recognize the dignity and humanity of our guests at the shelter, and so it's not just blank walls and kind of hard spaces.
Great. So we're getting ready to wrap it up. So Dave, I'm going to give you the last question, and we kind of talked about it a little bit. So we talked about what's the best way to volunteer. What's the best way to report an issue regarding homelessness? Is it using the MyHB app, or is there a different medium that you feel is the most effective to report issues regarding homelessness?
By far, the MyHB app is the best. It's really easy. You can put in something anonymously, or you can put your name. The nice thing is if you see it happening right then and there, you pull up the app, a few short keystrokes, you can geotag your location. You can take a photo of what you're seeing so we can actually see it and go to that same perspective, and then send it in. And our team of officers check that Monday through Friday, and then on the weekends we have them working. And they will literally give you feedback through that, whether it's by phone to ask questions, provide you some education, or provide photos in return to show that it's cleaned up. And then the second best option is our phone number, calling the H2 hotline for the officers. That goes to a voicemail, and it sends it to all the different officers. They can hear your voice, call you back if you ask for it, and again, provide feedback that we've gone out there, we've listened, and we've dealt with the issue.
Thank you so much, everybody. Thank you, Lauren, Timothy, Dave, Chief Harvey, Lisa, and Oliver for participating in tonight's discussion. It was a lot of information, and I think that everybody really covered all the points very succinctly and in depth. I also want to just make sure that our residents know to go to hbhomelesssolutions.com for the latest updates. Again, that's hbhomelesssolutions.com. That gives you a whole bunch of the resources, the things that we talked about, from Lauren to what Lieutenant Dave was talking about, from what Chief Harvey. So you can get a complete overview of what's happening. But thank you so much for everybody attending tonight. I thank you. And again, this video has been recorded and it will be uploaded on hbsolutions.com so that you can forward it to anybody who may have missed it. And with that, I thank you. Good evening. And we'll have more of these in the future. As Oliver mentioned, this is one of a whole series that we're going to be doing to talk about this important topic. So good night. Thank you. And we'll see you soon.